Christina Low-Kapalu, and I'm a pediatric psychologist at Children's Mercy. I'm hoping to speak with you today about some things you can do in the moment and some tools you can use to help reduce suicide risk in loved ones. We know that suicide risk is increasing, and we've seen an increase in suicide attempts in youth and young adults in the recent years. We also know that having thoughts about dying is very common, and asking about thoughts of dying does not increase the risk of completing suicide. In fact, it may be the only way you know there's a problem. Asking about suicidal thoughts reduces mental health stigma, opens the door to communication, and allows for connection to resources. The National Alliance on Mental Health states that suicide can impact individuals even if they don't have a diagnosed mental health condition. They also stress that having suicidal thoughts now does not mean you will always have suicidal thoughts, although it can feel like it in the moment. They go on to say, active suicidal ideation is often short-term and situation-specific, so in-the-moment support is critical. I will discuss some tools and resources you can use to help deal with suicide risk in loved ones. First, talk to the person who is having suicidal thoughts and ask them about what they've been thinking. If they disclose suicidal ideation, thank them for sharing this personal information and for trusting you enough to share it. Then acknowledge how bad they are feeling and tell them that they're cared about and not a burden. Instill hope for a better tomorrow before connecting them with trained counselors, primary care provider, trained support people, religious leaders, or crisis hotlines or text lines. It's really about what's available in your area and what you feel most connected to. There are ways to make the home safer if you have a loved one who is suicidal. Learn about and implement means restriction, which may include things like securing firearms or medications in the home so that those crisis moments can pass without drastic action. Individuals who are feeling suicidal can work with a provider to learn coping skills and create a safety plan for those really tough moments. And as a family member, you can learn about ways you can support your loved one by connecting with reputable resources such as the National Alliance on Mental Health, the CDC, the National Suicide Prevention Lifeline, and other organizations. To learn more about means restriction and other important topics for promoting child and teen safety, I highly recommend the Prepped and Ready Parenting into the Teen Years training online through childrensmercy.org, which will be linked below. Thank you for your time, and remember that suicidal ideation is common and there are ways we can reduce risk to protect our loved ones.